This podcast is on personal and professional appearance. It is to help you know how to dress in a professional situation as a healthcare worker. What I hope you're able to do when we're through with this is be able to actually demonstrate the standards of professional appearance in your internship or at a work environment. If this person walked into your room, would she inspire confidence in you? Would you feel like you were in a position of competence, that she could calculate your dosages on your medications, that she could start your IV? Her dress does not inspire confidence. This is not what I'm looking for. Now, obviously, this is not a real nursing outfit, and somebody wouldn't walk into a hospital with this, but it's used as an example. When you look at her, you do not see somebody that's medically fit to take care of you. On the other hand, when you look at these students, they inspire confidence. They look like they are dressed in a way that they are there for you. They're there to help you. They know what they're doing. They know how to dress. They know how to take care of you. Now, this may not be the case at all. I have no idea what their grades are. I have no idea what school they went to. But when I see them, I have the feeling of confidence. And that matters in healthcare. That people can trust you and believe what you say makes a difference. If they can't trust you, they're not going to be compliant with what you ask them to do. You have 20 seconds to 4 minutes to make a first impression on somebody. And they form that impression based on your appearance and your body language. Now, over time, you can change this impression, but it takes time. And in a hospital situation, you normally only have a few days. So you want that first impression to inspire confidence and to be the impression of the person that you truly want to be. As far as uniform goes, it should be neat, it should be clean, it should fit, it should not be wrinkled, and it should be the correct color and style for where you're working, and your facility will tell you that. If you're wearing something that's white or neutral colored, then your underwear should be white or neutral colored. You should not bend over and distract other people from their true goal. The top picture is well fitting. It looks nice. She can squat down. She can bend over. She can raise her arms over her head. She can lift patients, and everything will be okay. Her pants won't fall down and the seams won't split. It fits. The picture on the bottom does not fit. She would be there for the wrong purpose. It's too tight. She can't wear it. Name badges. The law says you are required to wear a name badge with a picture. It must state on it your name, your credentials, what department you work in. It should be at your shoulder level so that when you lean over a patient's bed, the patient can picture your face and that picture and can compare the two. It should never be on a lanyard, which is the top picture, and it should never be worn at your hip. Those are infection control nightmares that we are not going to perform ourselves. The next thing I want you to consider are your shoes. I want you to wear white or light colored shoes that fit well and give a good support. You're going to spend a lot of time in these shoes, and they need to be comfortable. If you wear poor fitting shoes, you will get tired faster, your feet will hurt, your legs will hurt, and you won't be able to take care of your patients as well. You need to have low heels. You need to clean your shoes daily. And if your shoes have laces, when you clean them, you need to take the laces out, clean the shoes, clean the laces separately, and then relace your shoes. You need low heels so that when you bend or you lift or you go to help your patients, you have a steadiness to your gait, and you and the patient won't fall. You also need to be able to run. So therefore, your shoes need to have a back. When you're running down the hall, you don't need the shoe to fall off and trip you, and then you roll down the hall and take somebody else out with you. The shoes need to be safe. As far as Crocs are concerned, I'm okay with you wearing Crocs. Just make sure you put the back across your ankle so that they're secure. And please don't wear the Crocs with the holes in them. That is unprofessional, and it could allow body fluids or other drainage to get through to your skin, and that is unacceptable. So be careful with your shoes and choose wisely. Next, I want you to consider your fingernails. With your fingernails, they should be short and clean. I don't want them to be able to tear through your gloves. I don't want them to be able to scratch your patient, and we certainly don't want a place that harbors bacteria or pathogens. I also want your fingernail polish to be light or to be clear with no chips. You need to be able to see through the polish to see if you have any kind of contamination underneath your fingernails. This allows you to keep them clean and to be in the best position possible not to transfer infection from patient to patient. Also, fake nails are not appropriate, and they are banned in most hospital and medical care settings. The picture at the top is unacceptable. You can't see through it, and they're a little bit long. The picture on the bottom, beautiful set of nails, clean, easy to see. Also, make sure you use lotion on your hands to keep your skin from cracking, and that way we don't unintentionally contaminate ourselves. The next thing I would like for you to consider are tattoos. Now, it is absolutely your prerogative whether to get a tattoo or not. You do need to know that legally a healthcare facility can refuse to hire you based on visible tattoos. So all I am really asking you to do is think before you do. I'm not telling you not to get a tattoo. If you choose to get one, that's fine. But think about what you want to do with your future, what profession you want to have, and just think first. The tattoo on the top, it's all down her back. It's a large tattoo, not necessarily something I would choose, but that doesn't matter. It is completely appropriate. It can be covered with scrubs, and there should not be any time she's at work dressed appropriately that's visible. The tattoo on the bottom is inappropriate. It's on his face, almost impossible to conceal on a daily basis. So just choose wisely, think first, and don't put yourself in a position to be unhireable in the medical profession, since this is what you are choosing to do with your life. Now we're going to review just a little bit. Why must your nails be short and clean? The main reason: we don't transmit germs, we don't scratch our patients, we don't tear through our gloves and possibly contaminate ourselves. What color undergarments should be worn under white scrubs? White or neutral. If you're dark-skinned, it is perfectly fine to wear flesh-colored underwear, but it should not be distracting. Describe appropriate fingernail polish. Clear or light enough to see through with no chips. We do not want to transmit bacteria, and we do not want to have contaminated nails. These are slides of my resources. I certainly hope that this has been a resource for you to use when you are looking to dress professionally for your internship. Feel free to refer back to this podcast as many times as you need to. Thank you.